One big ticket item in the budget should be health care. The Liberals and NDP have agreed on a Pharmacare deal. And joining me to talk more about this is Dr. Kathleen Ross, a family physician and president of the Canadian Medical Association. Dr. Ross, thanks for being here.
Pleasure to be here, Renee. Thanks.
Now let's start with Pharmacare. With what we've heard so far, are you optimistic about this plan?
So I think that there's a need to shift how we support Canadians in their healthcare, and we've certainly seen that movement towards historic investment in healthcare over the last year. And we really do need to ensure that those investments are optimized so that we can fill the gaps. One of those gaps is the affordability of medication, and I'm certainly looking forward to seeing more details about this Pharmacare plan, how that rolls out between the provinces, and will that actually address some of the critical needs we see in healthcare.
What about some of the structural healthcare issues across the country?
There's extensive reporting on this in the last several months, but more than 6 million Canadians without access to primary care, lengthy wait times for everything from diagnostics to life-saving cancer treatments and surgical procedures, and of course, emergency departments full to the gunnels across the country and closing. There's many issues that we need to tackle, but that transparent, accountable goal setting that Canadians can actually say, did our dollars go to address the critical challenges that we're facing, and where are there still gaps and how do we fill them?
Has the healthcare system strengthened at all since the pandemic, or are those challenges still there?
So many of these challenges existed long before the pandemic. This is a problem that's been decades in the making, and I'm hoping that with good collaboration across all the jurisdictions in Canada, openly naming and setting these goals that we can move towards will accelerate improvement, but it's going to be a slow process.
Of all of the challenges within the healthcare system, what needs the most immediate attention?
Well, I think moving towards access to primary care, that front door foundational basis of our healthcare system, has to top the list. And we know that we need to move towards those interdisciplinary, team based models of care if we're going to meet the needs of Canadians in a short term. Looking at improving our community care services so that we can offload patients from our emergency department, increasing our access to those acute care beds that people that need to be in hospital are in hospital, and those that can be managed at home are managed at home.
All right, Dr. Kathleen Ross, family physician and president of the Canadian Medical Association. Thank you very much for your time. Great chatting with you.